we're back.
And we're back.
Yes. I cannot believe that another year has come and gone.
Have we been doing? Is this the third year? Is this the third year? No.
Definitely the
second. It's got to be the
maybe,
second.
yeah, we may have even started like in 2024.
That's
just
incredible.
Maybe. Yeah.
That's a lot of info.
It is a lot of info. And that's why, I always want to come up with good things to talk about.
For sure.
And this is probably redundant because as we've been sitting here looking at the data, there seems to be some overlap in influenza-like illness,
which is to be expected around this time of year. Correct.
Yes,
I mean,
for sure.
A lot of good information, of which you could find on the Woodford County Chamber website. Visit Woodford and What's Up Woodford.
Yes.
Go back into the catalogs, and there's a ton of content out there
yes.
You can listen to with Wellness in Woodford and
yes.
all of other amazing podcasts. We're getting a new one soon, too, by the way.
And, I mean, this is this year, I guess, is a little bit different because of the new variant. It's subclade, but it's a variation of flu A. And flu A right now is about 95% of all flu cases are flu A. So that's the dominant variant right now. We could see that change toward the end of the year, or not of the year, but of the season. But Corey and I were just looking at the data. Last year, we had
good data.
2 peaks. And the main ones were after Christmas and around Valentine's Day.
My guess was Thanksgiving and Christmas, but I think that makes a little bit more sense. And we did that right before. I wish we'd had that realization on the literal episode right now.
Yes.
Yeah.
Yes. So we're peaking. It looks like the first one is peaking right after Christmas. Now, it'll be interesting to see, because it looks like right now that we're seeing a decrease.
Yeah.
But that just shows it's actually just a little bit of a lag in the data. We're always about a week behind. It would be nice to have real-time data.
Oh, gosh.
But that's not possible just yet. There are certain things that and there are certain people that have access to that. I'm not one of them. But
I think a week's pretty good.
Yeah.
That's a lot of cases being recorded and sent out and logged and everything to be done in a week. So
yes.
Whoever's doing that, kudos.
Yes.
You mentioned flu A.
Yes.
How many flus are there?
So there are primary flu A and flu B, but then there are different variations of
little branches.
Yes.
Off of those.
So most flu shots are called quadrivalent, so they cover 4 types.
I've heard that.
So like usually it's 2 flu A, predominant flu A, and then 2 flu B. However, this one this year was trivalent, protecting against 3 types. And it was because that flu A variant had not yet emerged.
Okay.
And so we see that typically in our southern hemisphere, they go through flu season before we do.
Right.
We create the vaccine based on the predominant variants that are emerging. However, this subclade variant did emerge after, and so a lot of people are saying, "Oh, this flu shot's not as effective." Well, true in that it's not going to prevent you from getting the illness. You're still going to,
It just makes it weaker?
Yes.
Okay.
And that's really the thought behind or the purpose behind most vaccines is it doesn't necessarily prevent you from getting the illness, but it will decrease hospitalization and death.
Which I could see because an extent, probably some people, it could weaken it almost to the point of you don't even notice you have it.
Exactly.
So people think, oh, I took it, I didn't get it. But you did, you just didn't notice.
Yes.
That's interesting.
It is. And I never wish anyone to get sick. And my family included in that. But there are 7 of us in a household, and when we get sick, it's usually the same thing.
It's going to be
we
like
have
flu Z by the end of that.
It is.
It's going to keep bouncing around.
It's a Prather Petri dish. We're just doing our own little scientific experiment.
Oh, Lordy be.
But, it may be that one of the kids has more like gastrointestinal type symptoms. The other one, only a sore throat. Other one, just a headache.
Right.
So it's always kind of interesting to me how...
Katie never gets sick. I feel like she's got a really great immune system. It's usually it's I feel like Avery and then me, and then if Katie, then Katie.
Then she.
Yeah, but
she must have a great immune system.
She's got that. She always says it's because of her blood. It's like O negative or
O negative,
what's
the most rare?
I see. She gets into all the. I don't know. We're not. I want to stick to the data. Not her.
Well, listen. If there's some kind of super immunity out there that Katie is got.
Oh no, they're gonna ET her.
Yeah.
They're gonna get her.
Yeah.
And they're gonna test her blood.
We're gonna have some more of that.
Yeah.
Take a shot.
I'm just now getting over. I'm on the way downside of. I just call it crud. I don't know.
Yeah.
It was just it started off as a kind of a sore throat in the back, but and then it just was stopped up nose.
Yes.
Which I mean I don't, and I know I'm saying this on a health podcast, but Afrin is like wherever they got Afrin or how they it is magic.
Yes.
Right up there with Neosporin. I feel like it takes it. It's beautiful. Because
it's great.
It completely gets, but I understand you can't use it too much. Cause,
yeah.
I mean, I probably have a hole you could probably bowl through in my septum, but it's amazing. I really try not to use it too much because that does scare me a little bit. But yeah, and then before that, we were talking before the episode. That was that sinus thing that was that's going, and that's miserable.
Yes. My husband John got sick with that.
Yes.
He was really sick. And then one of our daughters got it. And I'm telling you, I looked at her throat and it was scarlet red.
Yeah.
I've never seen anything like it. I've seen throats that are hand, foot, and mouth.
Oh my gosh.
Strep, all the things.
You've got the inventory there, yeah.
This was really
that's brutal.
red. And when they swabbed her, because we did think, well, maybe this is strep.
Sure.
It bled.
Oh wow.
The swab had blood on it, so it was that raw.
Oof.
That sore. And if you didn't even know her and she talked to you, you would have been like, she has a sore throat. Like it was that.
Just by listening to her.
Yeah. So there are just a bunch of.
This makes you foggy, man. It's
enteroviruses. Yes.
And it's cold outside, and I don't want to. It's like I have to not only get up and be like, I go into the cold. I'm wearing like long johns and thermal.
7 layers.
Oh yeah, and then it's that.
Yeah.
So it's like a 1-2 punch there for you.
Yes.
Man,
so just what a season.
Wash your hands. Quarantine, self-quarantine yourself, which is easier to do in the cold months.
Yes.
Definitely.
Yes.
I hope I didn't come back too early. About a week ago, I thought I was good. Woke up, I'm good, and then I get somewhere and I'm like, I'm a mess, and I need to get out of here. I hope I didn't make everybody, sick around me, but I think I'm safe.
Well, the thing that I kind of just like the rule of thumb is, hey, if you don't have a fever for 24 hours and you've not been, fever free without any kind of medicine, like to offset that, you're generally good to go back.
Sure.
If you feel like it. Like I always say, like, don't feel like you have to go back just because you've been fever free, because I don't know about about you, but like when I have a fever,
I'm out.
Takes you out.
I'm out.
And that's what so the fever is the body's response to whatever pathogen that has entered your system. It's your body's response. And it's saying, okay, you can't, this virus, this bacteria can't live in, you know, this hot environment. So I'm going to raise your...
Like revving your engine.
Yeah.
Yeah.
So you're going to try to kill that off. And that's what your vaccines, most of them do, is they give just a little piece of that virus to you, a dead virus.
But well, we've had a vaccine episode, but this is good to hear because I'm, you're not around it all the time.
Exactly. It's always good to be refreshed, and I think a lot of people these days, there's so much information out there about vaccines.
Yeah.
And really, it's you're giving your body a piece of something that won't harm you, may get a sore arm, something like that. But when your body does come into contact with the actual flu, your body's going to say, hey, I've seen this before.
Hey, there you are.
There you are. I
We've
knew
been
you'd be
waiting for
back.
you, big dog.
Yeah, exactly.
Come on in.
I'm going to whip
safe.
you.
Yeah.
Yeah.
No, I'm good. I'm friendly. Yeah, come on in.
Yeah.
Not.
So that's I mean, the majority of the vaccines out there, that's kind of like the mechanics like of what goes on in your body.
They are like little machines. Like if you look at that stuff up close, they're like gears and stuff. It is one of the most crazy. And, I love to learn, and I love to think, why is that way? I'm going to dedicate however much time to just know enough to talk about it, right? But maybe dive deeper. That's one of the things that I would really like to dive in. I mean, you look at these things up close. It's like they have little legs. They look like diamonds or something, and they have like it's like something. It looks like something mechanic. It looks like somebody engineered this. It is wild to see. And if you haven't, you've got to look it up. It's insane.
Almost like a snowflake or something. Like it's so detailed that you couldn't even like replicate it.
For sure. It's pretty amazing.
Yes. And I guess that's why those viruses get kind of ahead of us, because they are, our bodies can only make, and our immune systems can only react so much before these viruses get smarter and they figure out kind of a way around your body's immune system. And so then we have to have a better, more robust vaccine. And then, of course, there are things out there like Paxlovid. I'm trying to think of the other flu. There's an antiviral for the flu, too. So, like, even if you have gotten your vaccine and you have the flu, if you've tested at home, if you've tested within, like 48 hours of symptom onset, you can get antivirals. And that can also boost your body into fighting, I know there used to be pretty strict rules around who could actually get that prescription. Because you kind of want to save those for people that are immune compromised.
Exactly.
But, so, and I understand that too. But generally, by this time in the year, we haven't run out of anything, and it's widely available.
And I'm sure you would put something out on Facebook or something like shortage. Or, okay.
And then they would start, only available for certain populations, and that would just be based on risk,
right?
So hopefully we don't run into any of that. But
we have the peaks. I think we We've got the peaks.
We've got the peaks here.
Christmas and Valentine's Day.
Yep.
Okay.
So this is all data plus on the Kentucky Respiratory Disease Dashboard. It's online. It's available to anyone. Again, it's Kentucky specific, but there are values and conditions and things like that. If you're a data
love it.
geek like me,
Oh, yeah.
and Corey is too. We were just like putting in different things before
Love it.
we went live. But we really, I mean, you can do lots of things with this. Influenza is primary. It's the primary culprit right now
Okay.
for infections. COVID and RSV are on here as well, but they don't
But they
seem
were
to
lower,
be.
right?
Yeah, they have increased slightly,
Mm-hmm.
but definitely. I mean, we saw a stark increase in influenza from the week ending in like the first week of December to yeah, so basically in December those numbers just it was a steady climb upward.
So now we have the data. We know getting into Valentine, because now that's kind of what the next, is that the next
Big
kind of
holiday
big dangerous,
get
get
together.
together scenario there. So now it's like, all right, let's prepare for
Let's
that, right?
prepare. Yeah,
Doing the right
don't go
things.
out with your cutie with
Yeah.
if
Don't
they
go to the
have the
movie
cooties.
theater.
So,
Yeah.
well, the other thing too to keep in mind, um, sometimes people look at these numbers.
Cutie with cooties.
Sorry,
No, that's good.
I like
I'm sorry.
puns.
It's
Puns.
got me. It's got me giggling.
Well, this data is based on um, either inpatient data or hospital data, which, so with that info, we are only getting lab confirmed cases.
Right.
So so we're not considering the tests that you have at home. Nobody knows that's going to be if that's
Right.
positive,
Wi-Fi
or
sends
if you
it.
go to the doctor.
Right.
If it's a swab, that's not going to be reported. It would have to be a blood lab
So there
specimen.
could be more.
Yeah. So it's
Okay.
always going to be underreported. And
Okay.
we always said that with COVID too,
That's right. Yeah.
So don't let the numbers just in sheer volume really, as far as like total number of cases, because the last I had checked, there were about 10% in like our adult and child population, 10% less people were 10% less likely to get vaccinated for flu this year.
Okay.
And we do see some adjustment in that, but
Sure.
been a lot of
And
information.
what was that website again? Because I feel like if I was listening, I'd be like, wait, go back. What was that?
It's the Kentucky Respiratory Disease Dashboard, and it was actually
Okay.
the one that was created and housed all of the COVID data, and then now it is maintained for all respiratory illnesses, and it's fairly up to date.
So this was created. This is new then. This is
new.
Since COVID, and then now we have this, and
Yep.
wow.
So I always like to remind people with health departments, there are over 100 communicable diseases that we investigate. Flu's not one of them. COVID's not one of them. RSV isn't one of them. But there are several more that we do investigate. And so there are lots of things that float around out there that really nobody ever knows about, but we do behind the scenes investigation and try to kind of stop whatever it is before it spreads.
Right.
But I know that there's been some information lately in the headlines about new vaccine recommendations. And again, recommendations and your interpretation of that word.
Right.
I want to make sure that Woodford County knows that whatever vaccine you want or need, we're going to make sure you get it here.
Right.
So our recommendations won't change. We will still follow the Academy of Pediatrics. And then we also have other patients other than pediatrics, but we don't do a ton of adult vaccines here. But we have programs, and I want to, because there are people that rely on us for vaccines. We still have those vaccines. And if you're worried about payment, if you do not have insurance or you feel like you're underinsured, you can still come here. We have vaccine from federal programs that we have here for you and your family members. It is my understanding, though, that if you have insurance, all of these vaccines will still be covered as preventative and paid by insurance. So that for those people that do want to stay up to date, and they need vaccines, and they're worried about the recommendations affecting the payment source, please don't worry. At least for now, it looks like those are still going to be covered.
Cool.
And so I just wanted to state that because there's been a lot of information in the news, and I want you to get it from me.
Right.
You know, I serve here locally, and we actually kind of do an expanded program to cover more people than we're statutorily required to cover. But that's our job is right. You know, that's, I always say if public health had a backyard, vaccines would probably be
that's cool.
And so I don't want our citizens, our community worrying about any kind of, you know, access issue or financial issue
based on what they're reading on the news.
You can still, we actually take walk-ins, but we open early and stay later to be able to
accommodate. I mean, you got people coming, childcare, jobs, traffic.
Yeah.
You know, I got to get there to get my.
Yeah.
Don't worry.
Talk to somebody.
Call the office here, right?
Yes.
You can message on Facebook.
Yes.
Woodford County Health Department. Yeah.
I had somebody this morning that reached out and said, I need WIC, but I can't come because my child goes to pre-K.
Okay.
Oh, you can.
Oh, okay.
We can come in. You can come in before. You can come in after.
Right.
There are some WIC appointments that we can actually just do. We call like it's telehealth.
I know those are fantastic.
Yeah. So you don't have to use the.
Is that another COVID creation too? Was that before?
Well, you know, WIC was not flexible prior to COVID, and now WIC is flexible because, well, we had to be. It kind of forced us all into being, and kind of, you know, with telehealth.
Yeah.
You know, and both. So with WIC, ordinarily, those are well children, well moms, that we're wanting to continue to keep them well. They're not sick. And so we're not necessarily diagnosing anything. I say that. We have some public health heroes here that have had to immediately refer to emergency departments.
Okay.
You know, if you have a newborn or any child that comes in here that's not thriving, that is not gaining weight, and, you know, there are some things that are emergent. But by and large, WIC program, once we get started, and actually I can bring on Kelly the next time that we have this to talk about WIC, because a lot more people are actually qualified or would qualify for WIC.
Interesting.
But they don't take advantage of it.
That'd be a great episode. Yeah.
Yes.
I think that'd be very beneficial.
Yes, because those benefits. So, you know, it's a little bit different, and I always say we don't get quite the uptake on that that we do like with SNAP, but simply because the foods that are offered through WIC have to meet specific nutrient requirements.
Okay.
So you have to get certain types of food, But those are foods that, usually are good for your family, your growing family. And if you're a pregnant mom, you want to be putting nutritious
Sure.
stuff in your body. So we know from the potential shutdown and the federal shutdown, that we still have a large population that
Right.
need additional implemental food services.
Right.
So reach out.
For sure.
If I'll tell you another thing, if you qualify for SNAP, if you qualify for Medicaid, those are automatic qualifiers for the WIC program. If you're eligible as far as women, infant, children. So reach out to us. Like I said, we open early and stay late because we don't just serve, we serve the working population too. So please reach out. And if you have questions, message us on Facebook. I take deep dives into vaccines and things like that. And so I'm always up for conversation.
You're a
about
nerd
that.
like me, man. You know what your craft, you're in it. It gets you, excited, so to speak, to learn more and have those answers. For the masses.
Yes.
I'll tell you another thing that I'd like to know more about is and this is me throwing myself out there. Medicaid and Medicare.
Yes. Oh, yes.
Like that would be a good episode, I think, to discuss exactly the difference and who's eligible and all that good stuff. Yeah.
That's a good idea. And I tell you what, we actually have a connector. And so she's a connector for Woodford. I believe she serves other counties. But she sets up in our foyer.
Oh, wow.
And she helps people get connected. And so with insurance and find a plan that works for them.
Yes.
I would love to have her on one of these. So we've already lined up 2
Yeah.
more. We got WIC and we've got Connect, because I always think about, and this is the only way that I differentiate between the two.
Right.
Medicare is for older individuals that need care.
Yep.
Because they're older.
Got it.
And then Medicaid's kind of for any. And there are circumstances in everyone's life that they may need to rely on these programs. And again, you would be surprised the qualifications or lack thereof that you would have to be supported by one of these programs. And you may not be in that situation forever.
Yeah, exactly. I mean, you're in the business of preventative. So it's like, at least you'll know.
Yes. So I was going to look at my calendar here and see if I can tell.
No, the next time she's setting up.
Yes.
That's perfect.
And of course I don't see it I need it.
We can always push that out there as well. I think it'd be so beneficial. I mean, obviously I learned so much on this podcast. It's pretty incredible, all the things that you all do, that people don't, I know one time we were talking about if you needed to move
a body
out
a
from
body
cemetery, right? That's pretty out there. And then do you guys have something to do with oh gosh, my brain's drawing a blank right now. Oh my gosh, I can't believe I'm doing this. It's the tank under the ground.
Yeah, septic tank.
Septic tank.
Yeah.
Please don't tell my real estate friends that I completely forgot the freaking septic tank.
We do. So with another thing that just a tidbit on
septic tank. Wow. What's the matter with me?
We are the custodians for all like birth and death records. So and we're required to keep those forever.
Yeah.
And so that's another thing people I guess probably don't know that we do. But yes, we Barrett Sheck is our environmentalist, and he goes out on job sites or on the land to determine at what point like your water table is and where, like basically the best depth at which the soil can filter out
all the stuff,
poo and all that. So the ground can provide a great filter for that,
right?
But if you don't put the tank and the distributing box and then the lateral lines at in the appropriate place, and they aren't the appropriate length, you're gonna have sewage surfacing.
You're gonna have issues.
Yes,
stanky issue, man.
You'd rather do that before and make sure that everything is functioning or is at a depth.
Well, up to code,
size.
right?
Yes,
for sure.
It's typically based on the number of houses. That's part of one of the factors.
Mm-hmm.
So really, the size of the house doesn't necessarily matter, but a lot of times you do want to figure out, okay, how many bathrooms, how many people, because you don't want to overload the system.
Absolutely.
You can have lateral lines that sit empty, but you know, if they're all too full, that's a huge issue.
That's a problem.
It's a problem. It's a problem.
You can't do that.
Yes, I'm thinking about, well, Cousin Eddie.
Yeah. We all know the quote. I think that's a great. I wish I could end the show on that quote. Wouldn't that be funny?
Yeah.
No, man, this has been a great episode back. Is there anything, Save Round's final thoughts?
No, I think we've discussed a lot. We've covered a lot and a lot of stuff.
A lot of stuff to come.
Yes.
Be sure to check them out on Facebook, people. For questions, updates, alerts. Also, obviously, for on a community level here, any events that's going on, chamber, tourism. Go to Visit Woodford. Go to the Woodford County Chamber of Commerce Facebook. They have tourism has an app. It's crazy. You guys also do. Outreach events and stuff.
Yes.
We'll get back to you on the Connect for the setup there in the lobby. I think that's going to be a great episode. We've got a couple of good episodes coming.
We do.
So
we do.
Tuned.
And we get a lot of questions about Connect and coverage. And we've gotten a whole lot more because I think there are going to be some changes to that. And while that's not anything that we regulate, we want to at least be there to facilitate those discussions,
right,
and make sure that people have the information that they need to make decisions about their health care.
Faux show.
Yeah.
Miss Cassie, take it away.
All right, signing off. Another week here and keeping you well in Woodford.